You're listening to On the Front Lines of Psoriasis on ReachMD. On this episode, we'll hear from Dr. Atul Deodhar, who's a professor of medicine and the medical director of rheumatology clinics at Oregon Health and Science University. Dr. Deodhar is the lead author of a recent study examining the long-term safety of Ixekizumab in adult patients with psoriasis, psoriatic arthritis, and axial spondyloarthritis. Let's hear from him now.
We wanted to look at three diseases for which Ixekizumab has been approved by the FDA: psoriasis, psoriatic arthritis, and axial spondyloarthritis. And these are chronic diseases for which patients require long-term, sometimes lifelong treatments. And Ixekizumab is comparatively new drug, which is IL-17A inhibitor. And we wanted to see the long-term safety of Ixekizumab, since it is likely to be used for a prolonged period of time in these three conditions. So we decided to look at 25 randomized clinical trials. These are all the clinical trials that we could find for psoriasis and psoriatic arthritis and axial spondyloarthritis in which Ixekizumab was used. So in total, we had about 22,300 patient years exposure for this drug in these three different clinical diagnoses, so to say. And what we found out by doing this analysis was that the commonest side effect was infections. And that is not surprising because Ixekizumab is a biologic that blocks interleukin 17A. And even though it is targeted, interleukin 17A use in our daily life to fight infections, mostly fungal infections such as candida. So we were interested in seeing how common are the infections, what types of infections, etc. And to no surprise, the commonest infections actually were some ordinary viral typical infections like nasopharyngitis, upper respiratory tract infections, etc. And this is what we generally find in almost all the studies, so that was not a surprise. Candida, which was a specific infection of interest, since IL-17A is a cytokine that we usually use in fighting that infection, that was about close to 1 to 2 per 100 patient years. And this per 100 patient years is sometimes the patients find it difficult to understand, but the way I explain to them is that if I treat 100 patients like you over a 1 year period, 1 to 2 of them will have some candida infection. Also, I want to quickly note here that even though these were the commonest side effects, these were pretty mild to moderate. So patients who actually stopped Ixekizumab treatment because of infection was very rare. There are other side effects we were also interested in. IL-17A inhibition could lead to inflammatory bowel disease development, and that problem was found to be less than per 100 patient years, between zero point 0.1 to zero point 0.8. So not even half a patient. I mean, it's very less number of patients over 100 patient years develop new inflammatory bowel disease. So when we compared our results from this pooled safety analysis, we found out that what our previous experience was very consistent. No new safety signals were found in this pooled large number of patient exposures. As I said, 22,300 patient year exposure. And all these studies, these 25 studies, we actually followed till the end of study program. And our experience with Ixekizumab after this extensive data analysis, we found out that this is very similar to what we had found originally in the first 3 months, for 6 months, first year of treatment with Ixekizumab for psoriasis, for psoriatic arthritis, and also for axial spondyloarthritis. So no new data emerged. Another thing we found out, interestingly enough, was that year to year, we wanted to see what happens between year 1 and 2 and 2 and 3 and 3 and 4. If at all, the adverse events became less problematic. However, we didn't really do any statistical analysis. So what I can say is that year to year, there was no difference. So it's not that if you take this drug on a long-term basis, the side effects worsen. That is not the case. So what our study has shown is that there is more reassuring message about the safety of Ixekizumab from this very properly done phase 3 and phase 2 clinical trials in 3 different diseases. So the message to clinicians is to use these numbers in daily clinical practice in their conversations with patients, because that is one way of reassuring patients rather than giving vague risk analysis to the patient about this is increases infection or increases candida or increases IBD. Giving the numbers help the patient to make a shared decision with their doctor whether they should accept this new drug or not.
That was Dr. Atul Deodhar discussing the long-term safety of Ixekizumab in patients with psoriasis, psoriatic arthritis, and axial spondyloarthritis. To access this and other episodes in our series, visit On the Front Lines of Psoriasis on ReachMD.com, where you can be part of the knowledge. Thanks for listening.